Are some areas of the mouth more difficult to brush than the others? It absolutely is. Now, if you are not aware of all the zones of the mouth, this is from the Oral-B IO series, from the app that I've taken this. So if you look at the mouth is divided into 16 zones. So that is the upper right outside, upper right inside, and where you bite. Same upper left outside, inside, and where you bite. Same like that. And then upper front outside, upper front inside, lower front outside, lower front inside. So like that, it's been divided into 16 zones. So if you're using the Oral-B IO app, it tells you where you're brushing enough, where you missed, if you're brushing too hard in certain areas. It gives you all of the information on the app. App is not necessary for everybody, but if it is somebody who does have difficulty in brushing properly, or you don't have enough time, or you get carried away, or you're brushing too hard or too much, then all those reasons are why I would recommend this Oral-B IO and being very careful in using the app. Now, some areas of the mouth, so that is very difficult and I often see missed, is the number 11, 12 and 14. That is the insides of the lower teeth. Another reason why this area, although everywhere it collects plaque more easily, it's quite a difficult area to clean with any brush. So I would recommend that everybody, electric or manual, start brushing on the insides of the lower teeth, on the front and at the back. Another area that is commonly missed is at the back of the upper right and left side. On the outside, that is number 2 and number 8 on the screen, where it is sometimes, it's obviously mostly always the when it's your strong arm, it's against that. So if it's you're right-handed, it's a left outside usually. So the trick is to put the toothbrush in and then close your mouth halfway so you can get right to the back of the teeth, both sides, so that otherwise if you open too hard, the muscles push your toothbrush out. Another thing is that your salivary glands open on the insides of your lower teeth and also just next to your first molars on either side. And so the saliva is pumped out and the calcium from the saliva is absorbed into the plaque, and it forms hard plaque, which then cannot be brushed away very easily. So these are some of the most difficult areas to brush. Another very, very important technique that you need to implement is to have good lighting, good mirror, and keep looking at the mirror so you know where you're brushing for how long, and making sure that you're not moving the brush if you're using an electric brush, or in a circular motion if you're using a manual toothbrush.